Thank you for joining us for this week's weekly Wednesday presentation on the Medicaid Health Home Program. This presentation is being recorded and will be uploaded to the Otsego County Office for the Aging Facebook page and to our county website. I ask that everyone except for the presenter keep your videos turned off and that you remain muted unless you have a question. Please feel free to unmute yourself and ask your question at any time as we move through this presentation. You can also use the chat feature if you prefer, and I will ask the question for you. My name is Alicia Chase. I am Otsego County's long-term care coordinator. I supervise the Otsego County New York Connects program, and for those who are not familiar, New York Connects is the connection for all long-term services and supports. While my office is under Office for the Aging, we are unique in that we are able to help anyone of any age who is looking for help navigating the complicated long-term care system. We can help friends, family, caregivers, and clients who are looking for information and assistance, referrals, application assistance, and it doesn't matter their income or their insurance. If you are unsure, please do not hesitate to reach out to us. We also have a New York Connects partner with the Independent Living Center. My contact can be found in the chat, or for those of you calling in, you can reach me by phone by calling Otsego County Office for the Aging at 607-547-4232. At this time, I will turn the program over to Stephanie Thorne with Bassett's Navigation Program for today's presentation.
Hi, my name is Stephanie Thorne. I'm team lead for Bassett Community Health Navigation in Otsego County. My program serves Otsego, Delaware, Schoharie, Shenango, Madison, and Herkimer counties. Our partners are Catholic Charities Care Coordination, Catholic Charities of Shenango County, Rehabilitation Support Services, otherwise known as RSS, Southern Tier Care Coordination, and Schoharie County Office of Community Services. Bassett's Medicaid Health Home Program recently received a 2-year Level 2 designation status from New York State Department of Health. What this means is we had just completed a 5-year term and we were redesignated for another 2 years at a Level 4 status. 5 is the best, 4 is good, and so we were very pleased with that. Bassett Community Health Navigation works with a downstream community benefits organization, which is the partners I had just spoke about. And between the Bassett team and our partners, we serve over 1,200 active members, and we have over 43,000 contacts with these members within a given year. I'm going to talk about a little bit of the background, the history of the Medicaid Health Home Program. Our governor initiated this program in April of 2011. We didn't start working in our area, in our counties, until 2014, where we started with Shenango, Delaware, Otsego, and Schoharie counties. So I wanted to share that with you. And also too, a health home is not a place. A lot of people think it's a place. It's not a place. It's a group of healthcare and service providers working together to ensure that people get the care and services that they need to stay healthy. Once enrolled into the home program, you will be assigned, a person would be assigned a navigator, or our downstream partners call their navigators, they call them care managers. So if you hear the term navigator or care manager, it's the same. And we work to develop a care plan that maps out services that an individual will need to be on a road to a healthier position or in a healthier place. And some of the services that we include are connecting to healthcare providers, connecting to mental health and substance abuse providers, connecting to needed medications, help with housing, social services such as food, benefits, and transportation, other community supports that can support and assist you. Now, when we talk about actually the medications is we've always have felt that if an individual doesn't have means to get their medication, or they have trouble with transportation, that's really a serious, sorry about that, let this other thing pop up. It's really a serious condition if somebody doesn't have their medication. So the navigators will even work to get in the medications from the pharmacy or get someone set up with a mail order service. Other community programs could be HEAP, it could be other DSS services, it could be other services that agencies in the area provide to people. It's really our job to know what supports are out there for people with their individual needs. So, eligibility for the health home program. You need to have Medicaid, and you need to have either 2 or more chronic health conditions or one single serious mental health condition or HIV or AIDS. Additionally, the person needs to be experiencing any of the following risk factors: either a probable risk for an adverse event, which includes death, disability, inpatient or nursing home admission, mandated preventative services, or out-of-home placement; lack of inadequate social family housing support or serious disruptions in family relationships; lack of inadequate connectivity with the healthcare system; non-adherence to treatments or medication or difficulty managing medications; a recent release from incarceration, detention, psychiatric hospitalization or placement; deficits in daily living such as learning or cognitive issues, or eligible enrolled in either their child or caregiver in the health home program. We get a lot of our referrals from our members as well. Bassett's Lead Health Home has over 1,250 members, as stated before. We have the 6 agencies that we work with, which was mentioned before. Each navigator works with approximately 12 to 45 members, depending on the level of where the member's at. We have different levels of what they need. So most of the navigation, full-time navigator has around 35 members, but their numbers, as far as they're rated, could be up to 50 people. Goals of the health home program include connecting members to the healthcare system, help encourage routine visits. That's one thing that when we're doing our intake, we identify everything that an individual possibly may be lacking or missing, and no shows and cancellation of appointments is one that is a big it's a radar for us to know that they really need the help. Also link members to resources, as I talked about before: transportation, housing, food insecurities. We're known to go to the food pantries for our members to get them extra supplies of food. We could connect them to SNAP benefits. There's a whole array of different ways that we could do that. We educate the members on their chronic health conditions. If someone has asthma or COPD or heart disease, they may not really totally understand what the chronic conditions are. So we help them understand either with handouts, or we read information to them. It's wherever level that the actual member is at. Sometimes we get their doctor involved, when we're having an annual team meeting, which our program does with their providers, to really get a good grasp on what they need help with and what they understand or don't understand, and how we can help them. We work on gaps of care. We have access to their Bassett, or even if it's not Bassett, their other entity medical providers provide us with medical information that helps us see where they may be gapping. And so gaps of care is a big one. the insurance companies. We also work very closely with the insurance companies that administer that help manage the Medicaid. So Fidelis or Excellus is in Otsego County. So they really want us to work on care with their members because it helps reduce the cost of the insurance. We organize efforts, as I said, to the team providers for their health. That is where the annual care team meetings come in. We work on reducing ED visits and inpatient hospitalizations that helps reduce the overall Medicaid cost. We help members towards independence and be able to navigate on their own. And the ultimate goal is for them to graduate from the program. Have we had some graduated members? Yes. Some never graduate, and others just are they're there and still need some help. But our goal is to graduate so we can help others. Who is eligible? We already talked about that. They have to have the Medicaid, they have to be an adult, and they have to have at least 2 chronic health conditions or else 1 serious mental health condition. What does the program cost? The program doesn't cost anything. Medicaid pays for the services that our program provides. How do individuals enroll? How can an individual be referred? Well, we have a couple ways. Well, the main way of doing it is to you could call our referral line, which is listed here, but really the referral form needs to be faxed to the number here on the screen, which is 315-867-1341. Then the next page is the actual, Okay. Before we get to the referral form, I want to talk about the health insurance. Our program actually offers assistance with health insurance through the marketplace. We have embedded navigators that usually just work with insurance for our members or for potential members. We get referrals from doctors' offices, other entities that are working with people that know that they do not have health insurance, and this is how we help them get health insurance. There's an insurance line number, which is 315-867-2480, and then you could send the referral, the same as the referral for the health home program, to 315-867-1341. Here's our referral form. And lots of times people think it's very cumbersome. We ask that most of the information that you could put on here to be put on, especially the contact information, like who's sending the referral, their phone number. And if you know this information, care physician information, we like that completed too. And the same organizations that they're working with. So if you're from an agency and you're filling this out, then you put your agency down here as who they're working with. If you really don't know who they're working with other than that, that's fine. And then we jump back over here to the demographic information. This PAM information is not anything that you need to do. Oh, sorry. The Medicaid information, the Medicaid SIN number is really important to us because that's how we do have to check for that they actually are eligible after we receive the referral. So we really do need the Medicaid number to process the referral. And then, complete this area for their eligibility as best as you can, what their chronic 1 and 2 conditions are, or if they have HIV, AIDS, or a serious mental health diagnosis. And then if you, oh, no, that didn't work either. Oh, I can't really get all the way down. That's okay. But anyway, we ask that for the risk factors for you to check all the boxes that may apply, but at least something should be checked. And then at the bottom of the form, it talks about if the member didn't sign this form, are they aware? And then, there's also a section that asks if there's any safety concerns. So that's important to ask. We would like that done. If you can ask them if they're a veteran, but we ask that afterwards. as well. Now I want to take a few minutes to this really explains, success stories really explains how we help individuals. So I'm just gonna read this to you. Michelle is a homebound member who has no cell service to use her cell phone, and she doesn't have the means. Let's see if I can move this to see this whole thing. Yeah. She doesn't have the means to get a landline phone. Michelle and her husband live in a rural town in an isolated road. She doesn't drive, her husband does, but he can't afford to buy a car. Michelle is on disability because of her chronic health conditions and receives $700 per month. Her husband has no income. Because her income is so low, she depends on food pantries as well as other community resources. As she has many determinants of health, she relies on navigation services. She has been enrolled since April 2019. Because of this, Navigator visits her twice a week to talk to her about her plan of care and discuss her needs and upcoming appointments or what appointments need to be made. In addition to, her providers contact me directly to relay messages to her and to coordinate care. Her husband calls Navigator by climbing a hill to receive cell service and calls twice a week. At that time, he discusses with Navigator what's going on with Michelle's health and discuss what Michelle needs are and how navigation can help. Since working with Michelle, she went from being a non-compliant with managing her chronic health conditions to being compliant. She didn't have a PCP, a mental health provider, or medications that she desperately needed that could have led her to unnecessary ED or hospitalizations. When she was connected to providers prior to navigation services, she no-showed appointments and wouldn't take consideration of what providers were recommending. Now she does. Amid the ongoing COVID-19 public health emergency, many families have been impacted due to loss of employment or reduction in work hours. In some cases, it resulted in lack of employer-based health insurance, or families could no longer afford the coverage. Navigators provide assistance with enrolling in health insurance coverage through New York State Department of Health Marketplace, and permission was granted by the Department of Health to allow navigators to conduct telephone applications remotely. This has been a great benefit on all accounts. One such example is a family of 5 who lost health insurance and household income due to the father's loss of employment. Although he was able to collect unemployment benefits, there was a delay in processing, and it posed as a financial hardship on the family. Soon after their health insurance terminated, Mom had a medical emergency which resulted in a visit to the emergency room, follow-up appointments, and costly medication. With the assistance of the navigator, the family enrolled in the Medicaid Managed Care Plan with a retroactive effective start date. Patient was relieved to know that her medical bills would be covered and she would be reimbursed for the cost of her medications. She also expressed great concern over having her 3 children, including a newborn, covered. There were many follow-up conversations between the patient and the navigator to assess the family's needs and to share community resources available to the family in these circumstances. And this is the last story. I have a member that I've been working with for over 3 years. I have been able to connect him with several supports that have helped make him more stable and overcome barriers to maintaining safe and healthy environment. He is an elderly amputee who was functionally illiterate and had several environmental challenges with his home. We were able to work with Oneonta Community Education to get him a literacy volunteer, which has improved his literacy as well as provide him with added social support. His wheelchair ramp was falling apart and unsafe. We were able to work with ORHA, which is Otsego Rural Housing Authority, to fund a new wheelchair ramp for him that is safer and more weather resistant. The windows on his house were old and not fully functional for weatherization. We were able to work with the USDA for a grant for him to get new windows installed. He has been able to maintain his appointments with several reminders and calendar review every month. He has been able to maintain his medications with some interventions to advocate with his prime care and pharmacy. He has completed his colonoscopy this year before the COVID crisis. He did, oh, that was last year now. He did have an ED visit in March for a sinus infection, but was able to follow up with a self-quarantine and did not test positive for COVID. He did not have access to masks, and I sent him some in the mail. We have worked on getting him an air conditioner through HEAP during the COVID crisis. We have gotten a letter from his provider and were able to complete the application by mail. He has been approved for the air conditioner, which will help mitigate the risk of some of his chronic health conditions escalating due to explanation by the heat. So those are just really some nice stories on how our program can help individuals. Does anyone have any questions? Okay. Well, thank you so much. I appreciate you having me, Alicia, and we'll talk again soon.
Thank you so much.